So the role of the clinical liaison is to make the transition from an acute care hospital setting to an inpatient rehabilitation setting. So what that entails is reviewing the patient's chart, getting their past medical history, why are they in the hospital, how are they doing in physical therapy, how are they doing in occupational therapy, do they have a therapy need, and do they have a medical need? And if they have all those things, then we can try and transition them into an inpatient rehab stay before going home at a higher functional level.
You have to have that bedside manner to be able to go and visit with the patients and talk with the patients about what they're going to be experiencing at rehab. You also have to have that marketing role as well, because you also have to be able to sell your services to the patients and families, because sometimes the last place they want to go is somewhere else after a hospital stay.
So it's a very positive, energetic type of sale because we're able to see outcomes that patients achieve while they're here, and the liaisons translate that back to our patients.
I've been in rehab a long time. I know what the teams do here. I know what the therapists do, the nurses, the physicians. I see the successes that create. So for me, it's very easy to sell kind of what we do. So it's clinical, sales, marketing.
I enjoyed the challenge of it because it's interesting in that you work with insurance companies, you work with case managers and social workers, the patients and their families. No day is the same, every day is different. There's always problems to solve and barriers to bust.
After 20 years of working in the field, I was looking for a change and looking for something different to do. I still get to meet the patients, I still get to talk to the family, educate them on what rehab is about and what to expect. But I'm not necessarily doing the heavy lifting of being a therapist, but it's still rewarding that I get to see the patients get to rehab and get the therapy that they need so that they can go home with their family.
I feel like we give them a hope that they may not have had, just to say, you know what, you're going through a really difficult time right now, whether it's a brain injury, whether it's a spinal cord injury, whether it's a stroke, things that they're not quite sure if they're going to be able to get back to their normal. And I feel like we can give them that hope that we can help you, we're going to do whatever we can for you, and this is the best place for you to be to get back as much function as you possibly can. It's so important to make that connection, make them feel more comfortable. Kind of gives them that like light at the end of the tunnel when they may not have had one.